Okay, here we go. Can you see it?
Yep, I see it.
Okay. Okay, so I just wanted to tell you guys a little bit about myself before I get started. My name's Kara, and first of all, thank you guys so much for getting on tonight, friends and family. I really appreciate the support. This is my very first one, so I'm a little bit nervous. Sorry in advance, because, yeah. Okay, so my background is I'm an LPC, so I'm a licensed professional counselor. And I work in behavioral health. I work in a private practice. So my patient caseload is people of all ages, young and old.
Hold on, Kara, just a second. Sorry, we got a few people that just joined, so by phone. So I'm going to ask them to mute themselves real quick. Sorry, I didn't mean to interrupt, but I want everyone to hear you. Okay, go ahead.
Okay, so my caseload is ages like 5 all the way up to adults. And I see a mixture of everything. So what I do love about my job, I absolutely love my job, but what I love the most is that I figured out how to incorporate Juice Plus into my passion, which is mental health. So a little bit about me and Juice Plus is my life before Juice Plus. I felt unmotivated, uninterested. I was sluggish, definitely unhealthy. And I'd probably go through 2 or 3 days a month where I was just really down and out. So with that being said, I suffer with depression, and I've suffered with it since high school. And I went through a really bad time in my life. And during that time, I had a plan to end my life. And thankfully, I had a lot of people and a lot of support with family and friends that helped me get through that. And I definitely would not be where I am today. I do take medication, and I'm through this PowerPoint. I'm not saying anti-medication, anti-prescriptions. I'm just broadening horizons. So I do take medication, and I think if that's what you need, then you should absolutely take it. But I think there are also other things to add in with that. So now I've been on Juice Plus for about a year now, and I just have so much more enthusiasm. I'm excited. I have more energy. I love life. I can find the positives in almost everything, which was not the case before. And I've only had maybe 1 down day a month. So even if that, it may be every other month. So I myself can see a huge difference, not to mention the community that I've built and all the friends that I've made through this that I would never in a million years would have met. And it's nice to make a little money on the side. So without further ado, here's food and yo mood. So what if psychiatric illness was treated as a nutritional deficiency? So what if we stopped with all these drugs, and then we take drugs because of those side effects, and then those side effects, and the list goes on? What if we could treat it with whole foods nutrition, or make it better? Maybe not get rid of it, make it better. We just don't know, and we're destroying ourselves from what we don't know. So mental health is a huge issue. I mean, there's tons of different facets of it. And you may personally not know you personally may not deal with it, but I bet you know someone that has. It doesn't just affect the person that struggles with an issue with suicide, anxiety, PTSD, all kinds of stuff, but it affects friends and family as well. So it's been said, this is Dr. David Katz, and he has said that this may be the first generation that kiddos have a shorter life expectancy than their parents. For me, that's crazy. I mean, kids are being diagnosed with all types of illnesses and chronic diseases at such a young age. I mean, we've got diabetes, obesity, hardened arteries, everything. And the drug percentage of kids taking prescription drugs is 25% higher. I have kiddos that come into my office on a regular basis, under 10 years old, that are on sleeping pills. What? This is crazy to me. This wasn't like this 15 years ago. So something something has happened and something needs to change. So what if it was said that we are whole foods, we are not just vitamin deficient, but we are whole foods deficient. We need the phytonutrients. We don't get that on a regular basis. You see the apple has over 10,000 phytonutrients in it. And sorry. Okay. It has over 10,000 phytonutrients, and that's the list of everything that you see on there. All of that is found in an apple. When you go to the grocery store, you don't see a label on it because you can't fit that much on there. And that would just be crazy for every apple, orange, grape, banana, pepper, green bean to have all of their phytonutrients listed on there. So with the phytonutrients in our bodies, we are not taking in the certain phytonutrients that we need. We get deficiencies, and some of those deficiencies are listed here. I mean, and these are things that we can't see. We can see people that are obese. We can see people possibly that have diabetes. We can see people that have oxygen masks they have to wear, but you can't see what's inside the brain. And this is just the beginning of what can go wrong. We're not getting enough of what we need, period. So our bodies can only produce so many chemicals. And I don't know, this is probably as sciencey as I'm going to get for you guys. So anyways, but these are the main chemicals that we produce. They are very important to us, and these are our happy chemicals, as you can see. So on the right, that is showing the different levels of our dopamine, serotonin, oxytocin, and endorphins, and then I think there's norepinephrine and epinephrine. When we have those different levels that aren't that are either overproduced or underproduced, that's when something goes wrong in our brain, and our brain's not getting the message transferred correctly. So everybody remembers the food pyramid. Well, they're kind of doing away with that. Nobody's looking at that anymore. Now the USDA is recommending half of your plate filled with fruits and vegetables at every meal. That's really hard to do for some people in their lifestyles. I know it's hard for me at every single meal. There is a ton of research that is backing up the increase of phytonutrients and micronutrients in patients, one of them being schizophrenia. So they upped their micronutrients, and that reduced the symptoms of patients with schizophrenia, and they were able to maintain that level. So there's something to say. There's a connection. Something is going on. Along with that, it's reduced ADHD, PTSD, lowered the progression of cognitive decline, lowered aggression in prisons. That's huge. The average cost for a family or an individual with ADHD is about almost $15,000 a year in costs. Well, we all know that our healthcare is going up. I mean, it's awful. Like, it goes up every single year. So that's for somebody with ADHD. Somebody with autism, which that's definitely on the rise, that family spends about $60,000 a year in expenses for education, loss of jobs, prison, and healthcare. It's just crazy. And the patients that I see, they're a lot of Medicaid patients, so they definitely they're good if they make $15,000 a year. They can't afford this. They just don't know. So from 2008 to 2013, this psychiatric study was done, and the treatment in kids for psychiatric treatments has doubled overall. So if antipsychotic drugs are just so effective, then why are the numbers of mental health illnesses increasing? Think about that. The more drugs we prescribe, the more issues we're having. I don't get it. It just doesn't make sense. ADHD's on the rise, autism on the rise, bipolar disorder on the rise. There's something to be said for all of this. This cannot be our new normal. We have ADHD, autism, depression, anxiety, bipolar, borderline, schizophrenia, the list goes on. 1 in 6 kiddos has a learning disability. 1 in 88 people have autism, and half of that are males. If this isn't concerning to you, then I don't know what will. Our chemicals are just not getting the things that they need, and we can get that through Whole Foods Nutrition. The science is there. The good news is 75% of all chronic disease is preventable. So cancer, diabetes, obesity, chronic pain, this can be undone. If 75% is preventable, what's really cool is that Juice Plus understands that. And one of the reasons why I love this company so much is because they're about prevention. So they offer the Children's Health Study, and that allows kiddos ages 4 all the way through college to get the gummies or the capsules for free for 4 years. This has been producing over their research and studies. There's less sick days, less doctor's visits. So what's that mean for mom and dad? You're not missing work to stay home with your kid. You're not missing work to take them to the doctor. Less sugary drinks that they want, and they eat more veggies. Imagine that. So these are 2 brothers that did Transform 30, and they had 22 sick days and 6 surgeries 22 sick days and 6 surgeries. And this is over a couple years. Now they're down to 1 sick day. That is incredible. Is this not something that we need to share? All kids need to be on this. So we know that the numbers are going up. You can see the percentages there. If you walk into any given school, 1 in 5 of those students that you see in front of you are going to have a mental illness. Half of the kids that drop out of school have a mental illness. And 70% of people that are in prison have a mental illness. There's a connection. What is going on? So this is Michelle. Michelle, she decided to get on Transform 30. She got on it because she thought she could, it's nice to be more healthy, but she mostly got on it for her son. Her son was overweight and he was being bullied at school. And he had made a plan and decided that he was going to take his own life. Well, Michelle felt like she had to help her son. She needed to do something. And so she, I'm going to do Juice Plus. I'm going to do Transform 30. My son can do it with me. It'll be a bonding experience. This is the least we can do. So long story short, as you can see where she got to, but the big bonus was her son lost weight. He is still here today, and he is, he has a better self-esteem. He is not being picked on. And the number one, he's still alive. So I don't know, it may sound kind of cliche, but Juice Plus kind of saved his life in a certain way if you think about it. She did say yes to Transform 30. And what Transform 30 is the trio, which is the Garden, Vineyard, and Orchard blend, and then the Complete Protein. The Complete Protein people have questions about this because a lot of people are diabetic. So where that red circle is, that's where we crash. The light blue line, it goes down, and that's where we crash after we have, we binge eat, or that's where we binge eat. When we have a sugary snack or food, and then we crash. Everybody knows that feeling. You have the low glycemic load, and you binge eat, and then that's when you're hangry. Well, the Juice Plus one is the darker blue, and it kind of evens out everything, and it's low glycemic. So in other words, you don't get hangry. You're able to make it from meal to meal, or you can supplement this as a meal for you. If I don't have it, I'm not very nice. Sorry. Mute yourself. Sorry. Okay. Okay. So Juice Plus, the whole variety is incredible. It's over 40 fruits and vegetables. That is an incredible variety of options. Even people that are vegetarians and vegans, they're not able to get this amount of fruits and vegetables in on a daily basis, much less the variety of it. So I know personally I wouldn't be eating no peas. I probably wouldn't be eating chickpeas. I probably wouldn't be eating a lot of that stuff on there because I don't like it. And that's why Juice Plus has helped me a lot because I never ate vegetables. Ooh, especially artichoke leaves. Gross. So I eat vegetables. I eat things that I would have never eaten before because I crave vegetables from putting that into my body. Research is really important to me because it's constantly changing. But one thing that we do know, especially in my work, like I have to follow certain criterias and studies. But what we do know is that the science has never changed behind fruits and vegetables. We've been told by our grandparents and great-grandparents forever, eat your veggies. We know this is true and it remains consistent. And consistency is really important with your health. So we're in over 30 scientific peer-reviewed journals. We have studies worldwide, and this is for everybody from womb to tomb, all ages. Anybody can do it. Prenatal, during pregnancy, after pregnancy, giving the baby, all the way up to elderly. All right, Christy, can you close us out?
Absolutely. Okay, so I'm going to go over the Transform 30 program really quick for you guys because this thing gets a little confusing. Basically, you have options. This program is not an end-all be-all. You get to pick what you're comfortable with. What we have found is that the Platinum program, the 2 shakes a day, and the Trio capsules is where it's at. You are literally flooding your body with over 40 different fruits and vegetables every day, and it takes the guesswork out of a lot of things to eat. 2 shakes every single day is super easy to make. Now, we're not saying that's the only thing that you eat. We're saying that it helps to, like Kara said, it makes you a better human. Those shakes are really, really helpful in being able to flood your body with a lot of good nutrition. You feel lighter. People notice that they recover faster from their workouts. So that's what we recommend doing. This is what the science shows. If you do the Platinum program or even the Gold program, there is a reduction in abdominal fat. You do improve from exercise, the recovery part. You are reducing inflammation, absolutely. Inflammation leads to sickness and disease. Your skin is going to improve. I don't have to look at one of my clients and say, have you been taking your Juice Plus? I can see within 30 days if they have a healthy glow in their skin or not. It's amazing what I can see visually on them. A reduction in the number of sickness days. Kara already covered that when it comes to the Children's Health Study. Improvement in your respiratory system, your cardiovascular function. We even have a dental study that shows that your gum health improves. Your antioxidant status is probably going to go through the roof because I'm willing to bet that nobody has ever eaten 40 different fruits and vegetables in a day before. Promotion of lean muscle mass is absolutely a real thing. In less than 30 days, I was able to put on 3 pounds of muscle mass while reducing my body fat about 2 pounds. That is from following this program very strictly. So know that if you want more details on how to actually do the program, just know that at a minimum, starting with the Trio capsules and the shakes is where it's at. We have guidelines if you want to take it up to the next level. But price-wise, you're looking at, if you want to start simple, kind of think of like our shakes as a healthy fast food. You're looking at $2.12 a day. Now, all of our products come in a 4-month supply. So know that each month, if you want to simply start with 1 shake a day, you're looking at $63.50 a day. If you want to do the Trio capsules or the chewables, or $63.50 a month, sorry. If you want to do the capsules and the shakes, 1 shake a day, you're looking at $4.43 a day, or let's just round up, $135 a month. Remember that this is food. Every single product we have has a food label on the back. When my husband and I did the 2 shakes a day, the very first month, we thought for sure that our prices were going to go through the roof at the grocery store. But we found is that we actually saved money because we were focusing on eating healthier, and we weren't eating out as much because we were feeling so awesome. So if you want to go all in, 2 shakes a day, which I absolutely recommend starting with, you're looking at $6.50 a day. Again, the nutrition of 40 different fruits and vegetables. If you do the capsules or the chewables that we have, you can sponsor a child in your life to be on Juice Plus for free for 4 years. You guys saw the statistics that Kara went over. Those children, 1 in 5 students in the school, you know, are suffering with some sort of mental illness or mental health. We have to really think about, first, food is medicine. This is where we sometimes really need to start. I mean, think about the times when you've had a Snickers bar and all of a sudden you're freaking out on people for no reason. It's because your body's not in homeostasis. Your blood sugar is not balanced. Food can solve so many problems. Ask my husband. When I get hangry, he knows it's time to give me food. Okay, so you guys have 3 options. The first option...
do.
Mute yourself. The first option is you're in option A. Option A means that you are going to strive to eat as many fruits and vegetables as you can. We're supposed to be eating 9 to 14 a day. If you find that you can't, and maybe you want to check out Juice Plus later, you know where to find Kara or the person who invited you. When someone introduces Juice Plus into your life, that means that they have decided that Juice Plus is going to be in their life for the rest of their life. So reaching out to them and knowing that later, if you want to try it, you can. But I just know that you don't have to buy Juice Plus from us tonight. Okay. Option B, I just went through the prices. They are right there in front of you. You can start with even as little as $1.50 a day if you want to start with the capsules alone, the red and green ones. Or like I said, go all the way up to $6.50 a day, flood your body with 40 fruits and veggies, and sponsor a child on that children's health study. Or option C, we have too many people suffering from mental health, from illness, from not being happy with their body, not being happy with their health. I lost my father at the age when he was 60 years old to reasons that could have been prevented. I don't want any of you to have to say goodbye to someone too early. I'm not saying that Juice Plus can save a life, but you know what? It can definitely give people more time. And we need messengers out there. We need people to spread this mission and this word about Juice Plus. It's a $50 investment per year. It's not something where you have to have a monthly quota or buy a certain amount of product. My husband and I got on this stuff because we knew we were going to be on it the rest of our lives. But there is absolutely a business opportunity. And in the matter of 5 years, I was able to offset the cost of our product. And now I'm at the top position in this company. And I just want to help more people be able to do that. So get with the person who invited you. Ask them the tough questions. If you don't ask them the tough questions, you have no idea what you're saying possibly no to or yes to. But ask the tough questions. I'm going to stop recording right now. So you guys, if you want to ask me tough questions right now, you can. But seriously, the person who's going to invite you is going to ask you. Who invited you is going to ask you if you're an A, B, or C.